Well, I think for both of the trials, what we're really looking for is longer-term follow-up in terms of efficacy as well as safety of bendamustine or rituximab versus the standard treatments which were previously being used, which was alkylator-based therapy and such as CHOP and CVP with rituximab. So indolent non-Hodgkin lymphoma and mantle cell lymphoma are two separate types of lymphoma. In general, mantle cell lymphomas tend to have more aggressive behaving disease, and treatments probably in general are a little bit more intensive for those patients, particularly the younger patients, which still tend to go on to autologous stem cell transplant. But I would say that, there are a lot of parallels. So in both cases, what we're looking to do is to obtain control over the patient's disease, to put them into a nice prolonged remission so that they can be living well without symptoms related to their disease and hopefully to be off treatment as long as possible. So StiL1 was quite a straightforward study design. It did include a variety of patient histologies, so different groups of patients with indolent non-Hodgkin lymphoma as well as mantle cell lymphoma, but it was pretty straightforward one-to-one comparison of R-CHOP and bendamustine rituximab, with the primary endpoint being progression-free survival. For the BRIGHT study, that was intended to be a confirmatory study to at least prove the non-inferiority of bendamustine rituximab versus R-CHOP or RCVP, and the primary endpoint was a short-term endpoint, so complete response rate. It does make it a little bit different, so I think the more relevant endpoints for indolent non-Hodgkin lymphoma and mantle cell lymphoma are progression-free survival or time to event endpoints, which makes this updated analysis much more interesting. So the objectives of the update of the BRIGHT trial was to really present the time to event endpoints. So to take a look not just at the response rate endpoint, which they presented initially, but really the clinical benefit in terms of progression-free survival, event-free survival, duration of response, and overall survival. They also aimed to look at safety with respect to deaths from other causes as well as secondary malignancies. In terms of the StiL trial, the objective was again to provide longer-term outcome data and to look not only at the primary endpoint initially, which was progression-free survival, but now to look more at time to next treatment, overall survival, and also look at the secondary malignancy rate.